In this video, we will explain how to use the NIBP cuff, what it measures, how to connect it, and how to make sure that you get proper measurements. The NIBP cuff can be used to measure the blood pressure of a patient. There are different cuffs available in different sizes. You have to select the size that is appropriate for your patient. You can check this by wrapping the cuff around the patient's limb. The index line must be between the specified range. Make sure you don't wrap it too tightly. There should be room for a finger in the cuff. There is a preference for placing the cuff on the upper arm, but it is also possible to place the cuff on the lower leg when the patient is laying down. Make sure that the cuff is not on the same limb as the SpO2 probe. Connect the hose to the monitor by plugging it in on the port on the side. Make sure you hear a click to ensure it is properly connected. When connecting the cuff to the hose, make sure you push it in all the way until the metal ring jumps back. To release, pull the metal ring down like this. When the cuff and hose are properly connected to the monitor and the patient, then you can start a NIBP measurement by pressing Start NIBP on the bottom bar of the monitor. You can also set up repeated measurements on the monitor, meaning that measurements will start again after a certain time frame. To do this, click on the NIBP field and set the interval to the desired time. Then click NIBP Start to start the first measurement. On the screen you will now see the time interval and when the next measurement will start. When you get an unexpected measurement, like an unexpected high or low systolic pressure, make sure that the right cuff size is used and that the cuff is not too tight. Also make sure that the patient's heart and cuff are around the same height. Possibly lay down the patient. If the monitor shows a cuff loose or no cuff error, make sure that the tube is plugged in all the way to the monitor. You should hear a click when it connects. Use a different tube and cuff when the error keeps happening.